valuables.
Hi, I'm Rihanna, and I bring my ambitious attitude to the team as well as my video editing skills.
Hey y'all, my name is Samantha, and I try to encourage our teams to take multiple different perspectives to the problem that we're considering, diabetes in Durham.
Hi, my name is Melanie, and to our team, I bring my creative mindset and communications.
Hey guys, my name is Aditya. What I bring to the table are my collaborative skills and my unique approach to the topic of diabetes.
Our team's strengths are that we bring different perspectives to the table. We're very adaptive. We've just spent a lot of time driving around Durham trying to get this project together, and we had to switch up our locations a couple of times, so we did it.
Although we initially struggled to pick a name, we decided to choose one that includes our Blue Devil spirit and our passion for global health initiatives.
Diabetes is a chronic disease that affects not only the life of an individual, but the lives of their friends and their family as well. It's a disease that requires not only a lifestyle change, but a support network and medical systems to help mediate its effects. According to the Center for Disease Control and Prevention, more than 100 million U.S. adults are living with diabetes or prediabetes.
According to the most recent behavioral risk factor surveillance system, North Carolina has the 16th highest diabetes prevalence rate in the United States. The CDC also said that in 2017, diabetes is ranked the 7th leading cause of death in North Carolina as a primary diagnosis and as a contributing cause of death an additional 8.1%. The American Diabetes Association stated that there are approximately 828,855 people with diabetes in North Carolina, and of these, 27,440 are residents of Durham County. This is why we want to take a closer look at the health outcome of diabetes mortality rate in Durham through the lens of the obesity epidemic. More specifically, we chose the Tuscaloosa Lakewood District, a food desert, because it is representative of a region where we are likely to see higher rates of obesity and diabetes.
Socioeconomic status, including income, poverty, and ethnicity, is a structural determinant that has contributed to the increase in mortality and morbidity rates in Durham, specifically due to obesity and diabetes. According to the Durham Health Innovations Project, the diabetes-related mortality rate for African Americans in Durham was 47.8 per 100,000 population, compared to 18.2 for white Americans. Over 13,500 unduplicated patients with a diabetic diagnosis were seen at a DUHS facility from 2007 to 2008. Over half of these patients were Black, which, when compared with the white Americans in Durham County racial profile, shows a disproportionately higher number of African Americans with diabetes in the Durham County. There are some fundamental reasons for these higher statistics among the population in Durham. The North Carolina 2020 policy report shows that compared to North Carolina as a whole, which has a 14% residents living below the poverty line, Durham specifically has 17.4 of its residents living below the poverty line. That is a 13.9% difference, and that's nearly 46,000 residents who cannot afford proper housing, have a severe lack of access to food, and are prone to crime and experiencing significantly higher levels of stress and anxiety. The higher poverty levels among the Black and Latino populations are specifically exaggerated when compared to white residents who are likely to own their own individual houses, another testament to the drastic income difference. These socioeconomic and structural determinants, specifically poverty levels and the high income gap, and the marginalization of African Americans and Latino populations have caused a sharp increase in diabetes and mortality rates. The statistics from Durham Health Innovations Project confirm that the mortality rate is twice as high for people with diabetes than the people without. Additionally, Durham Health Innovations clearly states that there is a direct correlation of low-income neighborhoods in Durham, the lack of accessibility to healthy produce, and increasing level of diabetes of children and adults. While the American Diabetes Association recommends care with regards to lipid intake and blood control, 44% of the individuals with diabetes in Durham never receive any sort of diabetic education, and that's primarily due to the inability to access and afford services and resources for self-managing behaviors.
I'll be talking about crime as a structural determinant. This district has high levels of crime. In particular, it has a crime index of 450.1 compared to the U.S. average of 234.7. According to the FBI crime report, the crime rate in Durham is 48% higher than the North Carolina average and 65% higher than the national average. In the first 3 months of 2019 alone, the Durham Police Department reported that homicides, rapes, robberies, and aggravated assaults increased by 13% compared to the same period the year before. Neighborhood violence has been linked to weight-related behaviors, obesity, and health disparities. The socioeconomic disadvantages of this community that Aditya mentioned earlier directly relates to higher violence exposure as well as greater rates of obesity. According to a study conducted by a research team at the University of Chicago Medicine, it showed that patients in areas with high violent crime rates had 53% higher odds of being obese and 25% higher odds of having hypertension compared to patients living in areas with less crime. Of the 14,799 patients examined in the study, 42% were obese and 33% had high blood pressure. The study concluded that repeated exposure to so-called everyday violent crime may have stronger effect on the cardiovascular health and metabolism, pointing to potential impacts of the body over time from living in an area of high crime.
One intermediary determinant related to this health outcome is food availability. Approximately 16.7% of the Durham County population is food insecure, which means that residents either have a limited availability of nutritious food or do not have enough food for an active lifestyle. According to the World Health Organization, a lack of accessibility to healthy foods has a greater impact on members of minority groups and residents of low-income communities. The overabundance of fast food restaurants and limited access to healthy foods in these regions contributes to an increase in obesity and diabetes. In Tuscaloosa, Lakewood, for example, many individuals do not have healthy eating options available within walking distance, which contributes to the inaccessibility of foods that support a healthy eating style. The area surrounding Tuscaloosa Lakewood is considered a food desert, which Healthy Food Financing Initiative defines as a census tract where a substantial number of residents have low access to a supermarket or large grocery store. These regions are dominated by convenience stores, which have a lower variety of healthy eating options and are more likely to distribute food with lower nutritious value. According to research conducted at UCLA Center for Healthy Policy Research, access to healthy eating options and poor nutrition impacts the rate of obesity and diabetes in a particular area. They found that individuals living in areas with reduced access to fresh produce and higher amounts of fast food restaurants and convenience stores were found to be at higher risk of obesity and diabetes.
Psychosocial determinants of diabetes focus on the impact that one's social, economic, and cultural practices has on their mental well-being. Essentially, it assesses how those factors may contribute to one's stress levels and overall mental health. Studies have shown that adverse psychosocial factors such as low socioeconomic status, deprivation, and trauma have been associated with both type 2 diabetes and obesity. In Durham County, especially in the Tuscaloosa Lakewood region of Durham, members face these issues on a daily basis. Poverty is linked with low socioeconomic status, and in Durham County, poverty rates are higher than the national and state averages. In the Tuscaloosa Lakewood area, the poverty rates are around 29%, which places a lot of people below the poverty line. Despite thousands of families living in poverty, Durham County continues to see the constructions of high-rises, new restaurants, and commercial buildings, oftentimes to the detriment of Durham natives. The rapid gentrification of the city may also serve as a stressor for some of the Durham residents who may face evictions or increased rent and higher cost of living as a result of the new upgrades. Deprivation is also a factor which impacts one's psychosocial outcomes. In Durham County specifically, reduced access to affordable physical and mental health care coupled with exposure to stressors that would increase a person's need for those services makes it so that residents in Durham County feel a strengthened association between type 2 diabetes and their adverse psychosocial outcomes.
This is a flowchart that shows the linkage between the structural determinants and the intermediary determinants. It shows that both of the structural determinants are interchangeable and both indirectly and directly lead to the intermediary determinants, which are also interchangeable.